I think we'll start now. Ladies and gentlemen, my name is Khwaja Shehryar Nasir. I am working as a orofacial pain consultant at Shaukat Khanum Memorial Cancer Hospital and Research Center. I am also a managing editor for the Journal of Cancer and Allied Specialties. And today I'll be conducting a workshop or sort of a session on publishing a manuscript in this 22nd Shaukat Khanum Cancer Symposium. So before further ado, we'll start. Just a small housekeeping rule. So during this session, I'll be asking a lot of questions from our panelists, who I'm going to introduce shortly. But I would like that our participants can also participate in this. So if you have any question or that you would like to ask our panelists or participate in the discussion session, please use the Q&A feature given in the bottom corner. And through that, I'll be able to read your questions and we'll be able to hopefully answer them. So I'll start off by introducing Dr. Arif Jamshed. Dr. Jamshed is a trained clinical oncologist. He works as a consultant in clinical radiation oncology at Shaukat Khanum Memorial Cancer Hospital and Research Center, Lahore. With over 3 decades of experience, Dr. Jamshed has been writing and actively publishing manuscripts. He has authored over 100 manuscripts and book chapters. In various capacities, Dr. Jamshed has served across multiple journals, and currently he also sits in the editorial board for the Journal of Cancer and Allied Specialties. Welcome, Dr. Jamshed. We also have Dr. Asif Loya. Dr. Asif Loya is a trained pathologist. He works as a consultant pathologist as well as working as a medical director for the Shaukat Khanum Memorial Cancer Hospital and Research Center located in Lahore. He too has authored over 100 manuscripts and book chapters. He actively reviews manuscripts for various medical journals and sits on editorial boards of various journals, including Journal of Cancer and Allied Specialties. Welcome, Dr. Asif. And we also have Dr. Michael Shatman. Dr. Shatman is a clinical psychologist with over 3 decades of experience in working in multidisciplinary settings for chronic pain management. He currently is a faculty in the Department of Anesthesia, Perioperative Pain, and Pain Medicine at Grossman School of Medicine at NYU. And also in NYU, he has another appointment in the Department of Population Health in the Division of Medical Ethics. He has authored over 175 publications and book chapters. He too has had served multiple editorial boards of different journals and currently is an editor-in-chief in the Journal of Pain Research. Dr. Shatman, welcome and thank you for joining us. I'm just going to reduce the size of the window so that everyone can then see us. Okay, so we'll start off, and my first question, because all three of you among you have almost 300 plus manuscripts that you guys have authored. I'll start off with Dr. Arif. You've been doing this for 3 decades now. Why do you feel that you need to publish, and why should one publish?
Thanks very much, Nasir. Publishing is something which in this day and age is extremely important, both from the author himself, who obviously for his professional development, his progression in his career, for his recognition. The only way people will come to know that you exist is if you publish something. And secondly, now if you even want to apply for, even if you want to get into medical school, they expect you to be active in some way in writing and publishing. For even housemen and even low, what you call jobs which are at junior level, it is expected that the candidate will have some form of publication. So from your own perspective, initially, for your recognition and for your progression and your professional development, publishing is become almost an integral part of medical training as such. And then further on, the only way you can communicate with other researchers is through publishing. If you do not publish, then there's no way people will know what you have done. As they say that if you're going to start work, then you must finish it. And if you finish it, you must then publish it. If you don't do that, then there's no point of starting a work or finishing it unless others will be able to know. So if you have any ideas, any theories which you want to share with the others, you need to publish it. Once you publish it, others will come to know about your work. And at the same time, it will also allow you to establish your networking and other people with similar research, then you can join in with them.
Excellent. Dr. Shatman, what about you? Why do you feel that we publish?
I think that in the United States, it's a very different system, but a lot of what Dr. Jamshed said holds true. It's important for dissemination of information, ideas, data. It's also integral to one's career. We have a tenure system here. Academia is very, very competitive. I work in pain medicine and also in medical ethics, as you noted. And if you don't, there's the old saying, publish or perish. If you don't publish, then you're not going to move forward. And it's interesting that even some of the best medical schools in the United States really have little concern about the quality of one's clinical work. They are interested in what they're publishing. And then beyond that, how much grant money a researcher is bringing in. I teach at NYU Grossman, which is very competitive, and it's 1.6% of students who apply are accepted. One of the reasons is that it's one of the small handful of medical schools in the country that's free. And it's a very expensive private university, but we write so many grants that, collecting another $80,000 American from the students is not important when, so many hundreds and hundreds of millions of dollars in grants are being written. So it's publishing, but it's also grant writing. And if you're a grant writer, you're the most highly honored person on faculty. And most researchers don't want to teach. And if you have enough grant money, you don't have to be inside the classroom. You don't have to be training. And if you run out of grant money.
Yeah, thank you. So I'm really happy that you brought this up, that there's a medical education part to it, that there are institutes that do require that their faculty needs to publish in order for them to, either stay in that tenure track or they may actually escalate that ladder of promotion from going from assistant professor all the way to professorship. And then Dr. Jamshed brought in the idea of how this is relevant in order for us to communicate or distribute with whatever work that we are doing or whatever knowledge that we have acquired in our clinical setup, and share those ideas with others working in different clinical setups or different cohorts. Dr. Asif, what's your take on this? Why do you feel that one has to publish? Do you agree with them? Do you have your own thoughts on this?
No, I pretty much agree with this. See, if it all depends on your mindset to begin with. I mean, there are people who have their mindset set on not going into academia, and just for example, in US, once you graduate, you have the option of just going into a private practice and just forget about academia and just practice your field of medicine. But those who are geared towards academia and making sure that they progress in life, as you said, from maybe an instructor to an assistant professor to an associate and to the professorship, it's very important for you to publish. It's very important for you to get the grant money in, because that's something that any academic institution will look for. Even when you're getting into medical school, even a small case project or a case report that you've done before applying to the med school, that really helps. And that is something that a med school is looking for. I mean, at least even in Pakistan these days, some private schools that, that I know of, those are good ranking schools. They actually require that you have some sort of a publication or at least some sort of a research work that you've done that you've managed to publish in a journal. As far as grant money is concerned, yeah, I mean, if you've had that before, you go into apply for the med school, that's very good. But when you get into the academic setting, by all means, the grant money is very important. So yeah, I mean, publishing is something that is very important. It, as Dr. Arif said, that it makes you known. People know about you. You publish the work that you've done. You make people know about the work that you've been doing, your field of interest, your specialty, and what you've achieved. I mean, if you don't do that, nobody would know. And then, that's the best way to apply for the grants and get into that role. So I pretty much agree with what they've said so far.
So that's great. So one, just for that, our audience and participants, so all of our panelists, they do agree that this is a very integral part of one's career, whether you want to go into academics or clinically you want to participate. It does help to disseminate information. It helps to build up your resume. It helps to improve your career outcome or projection, if you want to call that. So let's now take it a step further. Okay, so I know that publishing is important, and if I need to publish, I need to then start at some point. So let's assume that we have the data with us and we have a sample that you have done a study on. But now when we sit down to write a paper, what's your first step? I'll start with you, Dr. Asif. So where do you start from? Okay, now you have that data. What will be your first thing that you're going to do?
I think the most important thing is the hypotheses that you're trying to prove. What is it that you're trying to achieve by publishing that paper?
So your question that you have by that you mean the question that you want to answer
Exactly.
with that paper. Okay.
Exactly. Yeah. I mean, because once you analyze that data and the result that you're going to get, you need to know first in your mind that what is that result going to show you? Is there something that you're trying to prove by analyzing that data? And that one thing is so important, because unless and until you know that you have something that you want to achieve by analyzing the data, you're not going to get a good outcome. I think that's very important. And once you have that, then then you start building your data. You start analyzing what are the numbers that you're going to require, how you're going to evaluate that data, what are the statistics that you're going to run, the analysis that you're going to do, the results that you want to achieve, the figures or the tables that you want to put in to show that data. So, all these things are very, but the first things first, you need to know what you want to achieve by analyzing that data.
So the question, Dr. Shatman, I see you smiling there. What's your take on this? Where do you start from?
Dr. Asif just described things scientifically and was perfectly right on, very, very accurate. But the process here is so political. And, you start by forming a group of young investigators and coming up with an idea, because I think that there's power in numbers. And then, importantly, finding a mentor, finding someone who is a publication machine, as we like to call them here. And in my old age of 64 years, I've become a publication machine. So every week I am approached by a group of young investigators saying, we're looking at this and this and this. Right now, the big thing is chronic abdominal discomfort syndrome. And we want to put out a series of papers and we want you to mentor us. So again, I'm not exactly sure how things work in Pakistan, but unless you're being mentored in the United States, your chances of getting published in good journals is very low. And it's very helpful to, irrespective of what your data say and what you're trying to prove and your methodology.
We are going to get on that in a bit, the mentorship part and the authorship part. But so what's your process? Where do you start? So when someone does approach you and you have decided that you're going to you're going to write a paper on some topic of your choosing. So what's your process like? How do you start, or where do you start from?
I start by looking at the project, looking at early drafts, and seeing if they're making any sense. Because I come across, especially as a journal editor-in-chief, I come across some manuscripts where people are just lost, and they're trying to prove something that can't be proven. So I look at the viability of the project. I no longer initiate projects. I did for many, many years, but now I wait till others initiate it and get the greatest joy, and we'll talk about later, out of mentoring.
So here in Shaukat Khanum, we call Dr. Arif a publication machine. Every month we get like 10 alerts that he has published 10 new articles or 15 new articles. So Dr. Arif, what's your take on this? So what's your secret? Where do you start from?
Area has this habit of exaggerating things.
No.
I wish I was that good a writer who would write 10 papers a week, sort of thing.
I can second that.
I think we've got two things over here, because Pakistan as a developing country over here, when you have most of the work which is published is either what you call retrospective studies or case reports as such. Phase 3 trials or clinical trials, which are, first of all, you have thought about the process, you know what you're going to do, and then when the results come in and then you publish it, that's a different ball game as such. There you have a set of a thing where you look for. So over here, the first thing which you want, or where the trainees come to be, is they want a project which they want to do. So the project which you should be selecting is, it should be adding something to the already available medical knowledge. If you're going to repeat something which has already been done hundreds of times and you're going to write it, you're not going to get it published. So the first thing is, try to find something which will add to the medical literature. If it is something which is new, something which hasn't been reported before, something which is rare enough, something which is going to change the way people look at that disease or that problem, then it becomes something which is interesting to the publishers, and that would become something. So the first question you need to answer is this publishable? And anything which is new, or anything which adds to the already available literature, that is the thing which you need. So once you have screened that out, after that you can tell them to go ahead and do their study, look up and dig up that thing. So they should have a question. You only need to answer for them is, okay, if you go and spend your next 6 months going through about 2,000 charts, reviewing medical notes, and coming up with some form of an answer, will that be all worthwhile? So here is where I think most of the guidance needs to come from.
So I 100% agree with that statement. And I'm going to take you up on this. So one thing that I did, we feel that a lot of people don't rely on is the idea, okay, what already has been done on this, which I feel sort of makes the foundation for what your idea is going to be, like what everyone else has done on it. Which we refer to as literature review. So what's your take on this? How important do you feel is literature review, like what everyone else has already published on a topic? So what's your take on that? And do you feel there is a certain time frame that you should spend on this? Because if a topic that has already have a lot of publications on, someone may just get drowned in the amount of literature that's out there. What's your take on this?
However, what you call a mentor can help in this situation is that there may be hundreds of papers published on that particular thing, but there may be a certain point over there which hasn't been emphasized, or something which they are overlooking, or something which hasn't been given its due importance. You can probably take it on. But the guidance basically is that the investigator does his homework, comes up with a idea that he wants to do this. He's going to go and look into the notes and find out whether this patient benefited from the treatment or not. You can tell him straight away that if you're going to look at a treatment which has been done for the last 50 years and everybody has come to the same conclusion, you're not going to find anything new in it. But if there is, say, a side effect of that treatment which hasn't been previously reported, and that is the particular thing which you will be focusing on, or a particular subset of patients, then it may still be worthwhile going into that sort of what you're taking that line and trying to come up with an answer in that situation. So the thing is, before you start doing it, you should already have it in your mind that what you're looking for over there is something which will add. It should be something new. It should be something which will be of interest. To get an interest of a reader, you need to tell him something new. You don't want to tell him or repeat something.
So Dr. Shatman, what do you do for literature review, and what do you think is its importance?
I think the literature review is important. I think it's setting the table. And a lot of times the young investigators, early career investigators, will come to me and they've done the literature review and it's cherry picked, meaning that they want to go in a certain direction. So they only will look at certain studies that will support their points. And I say, no, we can't do this. It needs to be comprehensive if you're going to do a literature review, and find the discrepancies between studies and use those discrepancies as the reason to do a further investigation. But journal editors will automatically reject manuscripts with cherry-picked literature reviews, and appropriately so. So it's not just doing a literature review, but doing a critical and analytical literature review, rather than just saying X, Y, Z studies all said this and that.
So I thank you so much for both Dr. Arif and Dr. Shatman. So what we understood is that that you not need to cherry pick. You need to have an open mind. You need to see what already has been done, and that, as Dr. Arif pointed out, that your mentor also does come into play and play a role in this, because he or she can guide you in the right direction to take in order for you to spend more concentrated time into reviewing literature which is going to be relevant to you. Dr. Asif, what's your take on this? Do you have any advice for young writers out there who are going to be, doing this literature review? Would you like to add something to this?
Yeah, I think something else that I always think while doing literature review is, for example, in diagnostics, being my field, we always look for new markers or new, subtypes of molecular markers that have come up, or immunohistochemical stains that have come up for various diagnoses of various organs, especially various tumors, where they would help in making a diagnosis. But then, those have been tested in these tumors in the Western world a lot of times. You don't have that review available for patients in your part of the world, which, could behave differently. The tumors, as we know, in different parts of the world, based on your, based on your origin, based on your ethnicity, you would behave differently. And similarly, these biomarkers and these immunomarkers would behave differently a lot of times in the tumors in your part of the world. So that is something that you can always look for, and something that you can look into, talking to your mentor, that this is something that I've come up with, this is something new, it helps in diagnosing this tumor, but this hasn't been studied in, for example, in Pakistani population. So would it be good to have this thing done in the data set that we have? And perhaps we could come up with a different outcome or a different result. So something to think about.
Yeah. So wonderful. I really like how this discussion went. So okay, let's assume that we'll get back to writing the paper later on, but I want to, cover everything, and because the constraints of time. So one aspect is that you have to write a paper, but I feel that a lot of times the other part of the whole journey of starting from a project to end up getting it published in a journal, uh, it actually has multiple phases to it. And one phase that comes after one has finished writing is uh, how to come up with the right journal, or where do you send this piece to. So, Dr. Shatman, I will start off from you, and I'm going to come back to you afterwards as well. So, how do you select? Because you mentioned briefly that if you do not have a good mentor or a known mentor, so a lot of journals do not accept that. Is that something that you look for? Like, what are you looking for when you are deciding? Okay, I have written this manuscript, which journal should I send this particular manuscript to?
That's an excellent question. We have impact factors of journals that are,
Mm-hmm.
How often papers are cited. And if we write a paper, sometimes the paper is a pretty good paper, and some of the young investigators say, well, let's, put it into the New England Journal of Medicine. And
Yeah.
then it's up to the senior author to say, nah, it's not New England Journal of Medicine material. It's maybe better in the Journal of Bathroom Fixtures. There is no such journal, but we joke about that. But seriously, it's important to assess the publishability of the paper and then make a list and rank order the journals that it may be appropriate to submit to. And you want to start at the top. Obviously, we want to all publish in the most prestigious journal possible and one with the highest impact factor. In fact, universities in the United States, when they're looking at tenure, they look not only at the number of publications, but they multiply the publications by the impact factor. So it gets very scientific. So I recently submitted a paper with colleagues, and I thought it was an amazing paper. And we sent it to New England Journal of Medicine, who rejected it, JAMA, who rejected it, then the Mayo Clinic Proceedings, and finally we have it now in peer review with the Journal of Health System Management, which is a very good journal, but it's not the top. So we, have to teach our students that it's okay to be rejected, and we get some good comments sometimes why we're rejected. Sometimes we get no comments whatsoever. It's like, nah, we're not interested. But if we do get those comments, we think about them. And even if we're rejected, we will integrate them into our manuscript if they're good comments, make it stronger so that the next one down the food chain is seeing our paper as more appealing.
Dr. Arif, thank you, Dr. Shatman. So, Dr. Arif, how do you go by when you have to submit a manuscript? How do you select the journal?
Yeah, I agree with Professor Shetman. Of course, if you have an amazing paper, which is something the whole world would be interested in, obviously, then you can go and try for a high impact factor journal. But from developing countries, most of the papers which we do are, again, retrospective case reports or case series. Those are the sort of things which, if you are likely to put in high impact journals, they will be rejected, because most of them, they usually publish phase 3 trials or things which are at the cutting edge of technology. So for those who are publishing from the developing world as such, and especially if you do not have a trial to report on, or then you are better off making a list of 3 or 4 journals, because there are now hundreds of them. I mean, if you go through the list, it's never ending. Try to find out 4 or 5 journals which have already published things similar to what you have. So if you have a case report, you are very likely to get it published in a journal of case reports rather than a journal which publishes say a bigger series as such.
Mhm.
So if you have selected your journal properly, your chances of rejection will be minimized as such. And always look for a journal which has already published something similar to it. Once they publish something similar, it is very likely they may also be interested in what you have written as such. And then it also depends if you are writing, say, about your own population, then journals which will be interested in publishing would be journals which are from this region. So if you want to publish on an ethnic group of people which are indigenous to your geographical region, then that region would be the most interested in publishing your paper as such. So that would be my tip. Try to find a journal which has already published something which you have written, and if it is in the same category as such, then you will have much less chance of rejection.
Excellent advice. I felt that, these are all really good reasons. Dr. Shatman, do you want to add something?
Yes, first of all, I agree with Dr. Arif again, completely. Regarding case studies, you have to find journals that will publish case studies. My journal does not accept case studies at this point.
Yeah.
Once in a rare while, if it's big enough, we'll take a case series. I think that his advice regarding looking at journals that have published something on that subject is very sage, excellent advice. For one thing, and this is how political and competitive it is, but if you are citing studies in that journal in your introduction, in your literature review, then that's going to help the impact factor of that journal.
Yeah.
I know it sounds very jaded, but it's true. And there are certain journals that look very hard at that. We don't, but I have colleagues who run other journals who want to see their journal cited heavily in the review.
So for our audience who might not be familiar with impact factor, so impact factor of a journal is calculated by dividing the amount of times a journal's total number of articles that were published by that journal were cited in that particular year, divided by the number of publications for that year. Usually it's for 3 years. So for example, if I have a journal that published 10 articles over 3 years, but it got cited 100 times in those particular time frame, the impact factor for that journal is going to be 10. Dr. Asif, what's your take on this? You've been writing these papers for so long now, and you have hundreds of publications. How do you go by when it comes to selecting the right journal for your paper?
Yeah, I think what Dr. Arif said with regards to the publications coming out of the developing world and the not getting a chance to publish in high impact factor journal until it's a trial, which is not that common to come out of here. Mainly, these are retrospective studies. I think important thing to note here as on a secondary note is that you don't publish. You certainly find journals which have published something similar to what you want to publish, and that would help. But then you don't want to go into journals which are which have really sprung up a lot in the recent past, and that is that all they want is your money and they would publish it. So that is something very important that you should look for. Don't do that, because that is gonna have a bad impact on yourself, as well as on your studies, as well as on your future publications. Something that is very important that you need to.
Yeah.
And your wallet as well.
Yeah, thank you so much for bringing that up. And I'm actually going to go into that just a bit. Just wanted to ride on what Dr. Arif said earlier about one easy way of finding out whether a particular journal publishes that particular kind of topic which you are interested in is look at your site references, and look at if you have like 20 references that you have written in your paper, what is the most common journal in those references. So for example, if there is one particular journal that keeps coming up, the likelihood that whatever you are writing will actually be most likely accepted by that particular editorial board, because that's something that's going to be relevant to them. Dr. Shatman.
Yes, I'll be very brief. Dr. Asif makes another great point. My colleagues here are making wonderful points. But in terms of the journals, I think you put it in terms of just want your money. And that's a big piece of it. So you have to be careful with open access. And you can find the illegitimate journals by going to Beale's list. And Beale is a librarian in the UK, and he puts out a list, I believe, every year of predatory journals. And there are predatory journals or predatory conferences, and they have no interest in science whatsoever. They have an interest in the God Almighty dollar. So to go to Beale's list, which is you don't have to subscribe to it. I think you can just go online and find it. Will help identify these somewhat shady journals.
Thank you for bringing that up, and that actually is very good segue into my next question, which is on open access journals. So among four of us, we all sit in different capacities in editorial boards of open access journals. My take for you, let's start from you, Dr. Shadman, because you are the editor-in-chief of one of these journals. Journal of Pain Research is an open access journal. How do you build up on the credibility of these open access journals? Do you feel that these journals are credible enough compared to the ones that you get your hands on, like the one which is on black and white paper? Or do you think that the credibility will be something that will always be difficult to achieve for these open access journals?
Excellent question. The open access journals progressively are increasing in terms of their reputations and prestige. In Europe, for example, any funded research has to be provided open access. In the United States, that's not the case. When I took over as editor-in-chief 10 years ago, I went to my friends who are luminaries in the field, mainly in the United States, in pain medicine, and said, hey, I'll buy you some beers if you start submitting to us. And I got some of the very well-known pain people, particularly in the United States, from Harvard and Mayo Clinic and Stanford, to start publishing. And the credibility just grew. And they're saying, oh, so-and-so from Harvard is publishing in this journal. Maybe we should look at this journal too. So the credibility can be built. On the other hand, there's one journal I won't name, but it had a very high impact factor. It was open access, and they lost their impact factor for 3 years because what Clavariate Analytics, surmised is that they were writing long reviews and self-citing. And the editor-in-chief was doing this heavily, and they were fined by losing their impact factor for several years. So, again, for people involved with these journals, just do it right, do it ethically. It's about the science, ideally.
Thank you for that information. Dr. Arif, especially for someone who, most of these open access journals come with somewhat article processing fees, which for someone who's serving in a low income country as ours, is often very difficult to, arrange those funds because mostly institutes don't support them as well. So what's your take on this open access journals? Do you think that they are somewhat as reputable as the ones that we have on paper, or do you think that it's a lost battle, especially for us who are, again, in third world countries or low middle income countries?
I think from a developing world perspective, open access is one of the best things which has happened. The high quality journals, they all require a subscription, and subscription prices are prohibitive for any what you call, unless you are working in a hospital where the institution buys those subscriptions, your ability to access what you call medical knowledge will become pretty difficult in this region. But as it goes, in an open access journal, as it goes, it is one way where your research is published very quickly, At the same time, the full text is available to you. Obviously, I mean, like in anything, you have good open access journals, and you've got the ones which may not be that good as such. But then with time, the good ones will survive and the other ones will not. So your mentor may also help you over here in telling whether it is worthwhile putting it in this one or not. And as Professor pointed out, that there are other sources from where you can find out the journal which one is looking at, is it what you call a reputable one or good enough to have your research published? But I think they have contributed a lot to the developing world in a sense that the amount of knowledge which is now available, most of the articles when you're writing or you want to do anything, you have access to all these articles, and then you can write a very nice paper and get it published even as a medical student.
Yeah, and just to add up on this, I want to add this, that majority of the open access journals in West, they do have a subsidized amount available for countries that are serving in low-income countries or low-middle-income countries. Usually there is a discount of about 75%, 50%, and then there are few journals which actually don't charge anything. Dr. Asif, what do you think about open access journals?
So yeah, I mean, open access journals is, as Dr. Arif pointed out, it's they've really good thing that has happened to the developing world. You can easily access the articles. It's full article. You can review many articles. Your knowledge base can increase because you can keep reviewing various published literature. Something that is very important, that you need to make sure that they're part of the directory of open access journals, because that is something that is sort of one source where you can find out that if that is a legitimate journal and if it's a good journal that you can publish your work in. As far as the fees are concerned for publication in these journals, I know for third world countries, especially where institutions are not supporting, that can be an issue. But what I've learned over the years is that if you can, if you get if your article gets accepted for publication and then they ask for a fee, and if you can have your administrator of the hospital write to them with a legitimate reason that why you can't afford that thing, as to, for example, a hospital that we work in, it's an NGO, it's a charity-based hospital. And if we give them the legitimate reason that we're a charity-based hospital, but we're publishing, we're trying, we have a lot of work that is coming out, they do, majority of them do consider waiving the fees. And I have seen that, because I've written letters myself. So something that you should not, that should not dissuade you from, publishing in these, because it's going to be a charged publication, even though the journal is good. You should always ask them for a waiver, and trust me, they do give waivers.
Yeah.
You write to them, sorry, please go ahead. You write to them first time and they say it's $1,500. You write to them, you guys tell them, I can't pay 15. Okay, they will try to negotiate, like they'll say, okay, pay 1,000, and you say, tell them, no, I can't pay 1,000. They'll say, okay, what about 500? So you have to negotiate your price sometimes, but then that's how it is. Try to see if you can get a good rate.
It boils down to how good the manuscript is at the end of the day, because if an editor really likes your manuscript, they will try their best as well from their end. If they have any funds, they'll try to compensate and go on from there, which actually I'm not going to do a quick plug-in for the journal for Shaukat Khanum, which is a Journal of Cancer, Pain and Allied Specialties. Our journal is an online based journal. It's an open access journal. It is all manuscripts are peer reviewed through multiple stage. Recently, it got indexed at PubMed as well, and which I feel is a good bonus for our different all the researchers that are out there who are interested in publishing in field of cancer care. And at this point, we don't have any fees, so there is no submission fee, there is no article processing fee. It's all absolutely free. So going back,
I must add here that it's Shahryar's baby. He's the one who's taken it to where it is right now, and we're really, really, really proud of what we've achieved and what Shahryar has done.
Thank you.
Sherry, can I make one more quick comment about open access, please?
Yes, please, please.
A lot of the closed access journals or non-open are generally parts of societies, at least in the pain world. So, American Academy of Pain Management has one, the American Society of Interventional Pain Professionals has one. And what they're doing, because I sit on many editorial boards, is they're starting to offer an open access feature whereby if an article is accepted and for a moderate fee, it can become open access.
The gold access.
And
that's what they call it.
Yes, and that's becoming a progressively more popular option because authors want their works read.
Yes, because of the readily availability of the literature, as Dr. Arif pointed out, Dr. Asif pointed out, and you rightly so said so as well, that it allows a lot of people to read the whole paper for you, rather than for someone who only has subscription to that particular journal to review it. So Dr. Shatman, you said earlier that a lot of times young authors approach you and they all tell you that, they're trying to find that person who's a publication machine, who's writing a lot of publications. And then there are these lot of reputable journals which will not entertain you unless one of the co-authors is a recognized name in the field. So when for someone who's a young author who's coming out, or a young researcher who's just been 5 years that they have come out of their graduation school or their clinical practice program, and now they are doing research and writing manuscripts, what should they do? Should they be gifting authorships to different publication machines, or how do they decide that who should be the author for that paper?
It's a great question, Shahriyar, and I think there are ethical implications to it also, because there are publication ethics. I work with one young investigator at the University of Pittsburgh Medical School, and by the time he finished his residency, he had 140 publications. Very, very smart young man from Nigeria. I said, do you ever consider bringing Ajay Wasan, his chair of the pain division at Pitt, on? He said, "Oh well, Ajay's is too important, and he doesn't have the time." I said, "Go to him and say, Ajay, will you give this a read through and some criticisms? We'd like to have you aboard." And Ajay was thrilled. So now he's joining us on these papers. Same thing at Harvard with Dr. Gilligan, who's a luminary and chief medical officer of the Brigham. So my point is, while people are afraid to go to their chairs and ask them to participate, if most of the work has been done already, then the chair is usually flattered and happy to come along. So don't be intimidated by your chair, and inviting them to get into your group can be a very good thing politically. However, in Italy at one point, I knew that one chair at an important university where I published a lot would have his name on everything as first author. And I say, what did so-and-so do to get first authorship? And my mentee said, Michael didn't do anything, but this is Italy. This is how it works in Italy. And that's a little shady. So I think that there's a subtle difference, but go to your chair. Don't give that person a first authorship unless he or she did first authorship work. But ask them to be included. Ask them for their advice, their recommendations on a paper.
Yeah, so basically you want them to participate in order for them to be part of the authorship board, rather than just because they are the chair of the department. Dr. Arif, we were having a little bit chat on this earlier today. Would you like to share your opinion on this, on gifting authorship and who to include as a co-author?
Most of the good journals now do require that you do specify what each author has contributed. So and also the number of authors, there's a limit to it as well. But I think one has to contribute to a paper to justify his inclusion as one of the authors. I think there are ethical issues with it. And as it is, this change where you have to specify what your contribution is also will help probably in future to limit the number of authors as such. For the first author is always the person who has done the most work. So you may have someone who is the senior most in the department, or he's a big professor as such. He can take overall, and generally it is accepted that the last name in the paper is usually his, and the first name is the one who has done most. Usually the first three are cited as such in references, so the first three people tend to be those who have done all the legwork, and the one who has supervised or given the final go-ahead and given his approval to it, his name should be the last one.
Thank you. Dr. Asif.
Yeah, I mean, there are clear-cut guidelines as to who should be the author, and there are some. I know there are some rules in our part of the world that if you're a professor of the ward that you're working in, or the inpatient unit that you're working in, and if you're publishing something, then his name is automatic on it. So, well, that's
Yeah.
not something that should be the case. And like Dr. Arif said, that there are clear-cut guidelines, and clear-cut journals ask you as to what each author has done and what their contribution has been. So, we have to follow those guidelines. This gifted author and that kind of thing is not something that should be encouraged. And that is anyone who's worked for the paper and who's done their bit for the paper should have their name in it.
So, so just to sum up, excellent points made by all three of you. So someone we should definitely, if you're thinking about, okay, who should be the author of that particular paper, always try to see who actually worked on it. And which I do as well a lot, that if I feel that I'm too close or my vision is too narrow about a certain topic that I've worked on, is very close to me, I would, however, like to have an opinion of another person because sometimes they might not be as close to the project as you were. So it's always a good perspective to get from another person on this as well. And let's say they ended up contributing significantly on the outcome or polishing of the manuscript. You should definitely include them in your paper, and only those should be added as the list of authors, which will eventually help you, medically, also ethically make sense as well. So, we were talking about that now there are so many journals out there, and we've all worked in different capacities in different editorial aspects of a manuscript. So one thing that I feel now we have changing roles from being authors to being reviewers, because all of you do that and all of you sit in different editorial boards. I feel that, we get a lot of publication requests for different journals. That's something that happens when you have a journal. Is there now in this day and age a role of cover letter? Dr. Asif, we'll start from you and then we'll go over to the rest of the panelists.
I think, yeah, there is. I mean, a cover letter is always something that goes well if you're summarizing the kind of work that you've done. And a lot of journals actually do require cover letters still as part of your submission. So obviously, one important thing to note here is that you need to make sure that you're following all the rules and regulations of submitting to a journal. And most of the journals actually do require cover letter, but it's not a necessity, but it does help because you can summarize your work in that cover letter, and it sort of gives a first impression, based on the language that you've used in that cover letter, some points that you've highlighted about your paper in that cover letter and all that. So it does help. But then, if a journal is a good peer-reviewed journal with a good editorial board, even if you don't have a cover letter, your research, if it's a good paper with a good outcome, and what you're trying to prove is something that is new, or is something that has not been done before, or it is done very minimally perhaps, then yeah, it would help. It wouldn't require a cover letter to explain your findings and how you want to portray your paper. But in my opinion, I think it does help.
Yeah. Dr. Arif?
I think cover letter is important because some of the most times you can make a decision on the paper by just looking at the cover letter. If it is written in badly or there's no purpose to it, the title may not be wrong, or the what the paper is about. It is basically your summary, where either you will get the editor's attention or you won't. If you get his attention, then it can move forward. So a number of times, your covering letter will probably make a decision on your paper before it gets any further. So make sure that when you write it, you write it in a way where it has no mistakes, grammatically, spellings, everything should be perfect. And it should be clear, it should be concise, it should outline what the study is, but it shouldn't be lengthy, because he is going to only have attention span of about 10 seconds to look at it. If he likes it, then it goes on to the next step.
So this reminds me when I was a resident back in the day, not back in the day, a few years ago. So I was told by one of my mentors that the cover letter is just like your elevator pitch. And what I was like, okay, what is elevator pitch? And she told me that, so when you are in an elevator with your CEO and he looks at you, you have those 20 seconds to get his attention and explain to him or her whatever you are doing in this institute. So that's what cover letter does for an author as well. So that's your 20-second pitch that you're going to give to the editor, that is this particular article worth getting published or not. Dr. Shatman, what's your take on this?
No, I don't think I have anything to add. I think Drs. Arif and Asif did a very good job covering it. But the language is real important, and it is the kiss of death to submit a cover letter which is poorly written, and which kind of it gets the issue of English language and such, and challenges. So maybe we'll talk about that later.
Yeah, it gives you a pretty good idea what to expect from the paper as well. I agree. And moving on, so as an editor in chief, and then I'm going to ask this to the other panelists as well. What do you look for in a manuscript? What I'm trying to understand is that what makes a good paper? So what's up to you? Floor is open.
I think it has to be novel, something new. I think it needs to be methodologically sound, and it needs to be well written. And I told my 24-year-old son, who completed his graduate studies in policy, I said, you need to learn to be a good writer, because even if you don't have nothing good to say, if you say it well, people will attribute more intelligence to you than may actually be the case. And the same thing goes when you're submitting a manuscript. We've all read manuscripts which are poorly written, and you have to think about every sentence, like, what the heck is the author saying? And if it hurts my head to read it, I'm not going to accept it. That's my rule of thumb. And again, it gets back to that issue of the international authors submitting to English language journals, and that's sometimes the case, even if the science is brilliant. And that could be a whole new symposium right there.
Dr. Arif, thank you, Dr. Shatman. Dr. Arif.
What makes a good paper?
I know it's a very open-ended question, but
I think there are two aspects to it. One, of course, is that you have a content which is so powerful. You may present it in any way. People will take it, convert it into a good paper, and your paper will be published. But for ordinary human beings like us and those who have to write and get it published, that sort of idea is rare over here. It is something which is not likely, because if you have that kind of an idea, you're probably already a very good writer anyway. So the other lot, what they have to do is to make sure that they read instructions which are given in the journal, how their paper should be formatted, must make sure that you are complying with how they like your paper to be presented. And mostly it is very standard as such. You start with an introduction, then you put your methods and materials, then results and a discussion, and you put your references. Make sure all the formatting is done as the journal does it. If you present it first time in a good manner, and as the professor said, you may not have something good to say, but if you write it well, then it may look it very good as such. So for a paper to be a good paper, the first criteria is that whatever you do, you should be following the instructions and try to keep. In the age of word processor, there is very little reason why people should be making spelling mistakes, grammatical mistakes. The processor itself is correcting it for you. It is underlining it with red that you've got a spelling mistake over here. Your tables over there, additions, one of the very common things is 2 + 2 is 5. It's not 5, it's 4. Because they don't read it, they leave it for the others to correct their mistakes. And when you leave your things over there, which you haven't corrected yourself, which is your job to do, there's every chance that paper will be rejected. On the other hand, if you take extra care that everything is properly done, then you increase your chances of getting it published much more.
Thank you. Very wise words. Dr. Asif, what makes a good paper for you?
So, yeah, novel, obviously, as Dr. Shetman said, but language. It's very important. If your language is bad, trust me, it's nothing worse than for a reviewer to read a paper which is written badly. Once you start, feeling that the language is not good, you're not, the person, what they're trying to say, it's not making sense. That really puts you off. The reviewer is put off by these things. So this is something that is very important that you need to make sure that you do. Other than that, I always look for these, things where if it's a novel idea, if it's nicely written, then how it is presented, the figures, the legends, the tables. If you're comparing some 3 or 4 studies to present your idea, I think it's always good to just put it in the form of a table, because it makes it so easy to read and understand. So, all these things are very good, and something that you can follow and make life of the reviewer very easy. But obviously, at the same time, you need to make sure that all the rules that the journal has given you with regards to their publication requirements and how to submit the paper, you need to follow those alongside. So I think these are my takes on that. And I think something that I always look for when I'm reviewing a paper.
So, thank you very
Nasir,
much.
sorry, can I just add one
Yeah,
more
yeah,
point?
please go ahead.
Always make sure that your word count never exceeds what they've given. I mean, sometimes you see these lengthy things where it is clearly specified that the title should not be more than that. And then the title goes on to 2 pages and the discussion goes on, is a chapter. Nobody's going to read that.
Yeah.
Just make sure that you stick within the rules which have been set for you. Sorry.
Yeah. It has to be crisp. You need to just go in, because no one has time to, in their hands to go over lengthy papers or chapter, as you correctly pointed out. Talking about language, because I feel that, for non-English speaking countries, it's always a challenge. And that right now in today's day and age, there's all about talk about AI, artificial intelligence, chat GPT, I can't recall the name of the Google's similar machine. But so do you feel that right now there is a role of AI in paper writing as well? Like, especially, do you feel that these particular residents from these particular countries can take an advantage of something like this? Anyone wants to take on that, Dr. Shatman?
I think it can be very helpful. And again, if the journal is English language, AI can help with that. And we have a paper in review, colleagues from Pittsburgh, Mayo Clinic, and Harvard, and I, on AI in academic pain medicine. So I think I'm seeing better use of AI progressively as AI progresses, I guess. And I think it can level the playing field a little bit. Ethically, I have a problem with, it has to be in English. It sounds like, American exceptionalism and Donald Trump and all those evil things. And we're not exceptional, but the bottom line is that international authors from countries where they're routinely taught English in school, mandatory. Now it's the case in Italy and Netherlands, Scandinavian countries, Germany, come out better than, say, the French papers where English is not required because they have the French exceptionalism thing going on. So it's all very political and crazy, but it does make a difference. And a lot of the hardest papers to read, and accordingly, they're not necessarily going to be looked at favorably, are those where the English language use is poor. And we'll recommend sometimes, if the science appears to be good, that they go to an English writing, copy editing service, but not everyone can afford that, particularly from developing countries. So we can say, okay, Nepal, we're going to let you have this for free, but you have to have it written in reasonable English, and it'll recommend such and such a company, and they'll write back, we don't have the money for that. So, it's a catch-22. What do we do there?
I agree. Dr. Arif, do you feel that there is a role of AI?
I think AI is the future. It will have a role in almost everything, and there's no reason why it wouldn't have a role in medical publishing either. As the Professor Shetman correctly pointed out, it will allow also where English is not the first language or is not taught, you should be able to even write in your own language, and it may be able to convert it into English language using the AI. So if you're good, say, if you're in Nepal and you speak Nepalese, it will translate and also convert it into a scientific language in which the paper would be formatted. But obviously, there is going to be an increasing role of it. Like any technology, it is something which will make a difference. And it will probably also improve the quality of the publications as well.
Yeah, so for our participants, there are now tools available like Grammarly, even Microsoft Word actually now helps you and has this feature of giving you an advice if the grammar of a particular sentence is incorrect. I know Grammarly has a feature that can reword what you're trying to say in a more comprehensive English. And similarly, there are other programs available as well, which sort of, again, going back to these non-English speaking countries, one thing that I feel happens unconsciously or something unintentionally is that they end up, because they get so intimidated in trying to explain what they're in English, their point of view or their narration, they end up copying different sentences from other published work into their manuscript, which is something what we call plagiarism. Dr. Asif, we've spoken about this over years, about different plagiarism, different types of plagiarisms, and then now journals have different softwares that are available for catching these. What's your take on this? And can you help us understand this whole process, what plagiarism is, and can you tell our participants what they can do to avoid it?
Yeah, I mean, plagiarism is in any good journal. If it's a good journal, then they would have a plagiarism software and they will check for that. So that's something that actually also shows that a journal is good, that they are checking for the plagiarism. So yeah, for plagiarism, yeah, I mean, if you start copying sentences right out of the actual paper that you're reviewing or that you're getting the ideas from, you're just putting those exact sentences in there in your paper, then obviously that's going to lead to a plagiarism, fire up, and it'll signal that this has been copied from somewhere. So what you need to do is you really need to, what the idea that you've gotten from that paper that you're trying to sort of, look into as a sort of a backbone of what you're trying to do in your own setup. You need to come up with what you want to portray, but obviously the language barrier, then when it comes in, then you can always get help from someone in your institution, I'm sure, who is good at language, who can proofread that for you. who can help you review that, who can help you review the language. And like you said, there are artificial intelligence programs. Grammarly is there. There's a Chat GPT there that can certainly help you as well. So all these things are there. You just need to put in what you're trying to say. Don't copy that exact sentence from there. Just get help from other people who are there in your institution, or use help from AI. And then you can avoid that thing. But trust me, if you submit to a good journal, the plagiarism check is going to be there, and they're going to check for that. So if you copy those sentences, that's going to be a problem.
Thank you. So we'll move on. I'm gonna now take up a few questions before I know Dr. Shatman. We have, I think, 5 minutes from you before you have to go. So let me just do this quickly. So what about the ghost authorship? So, for example, we know that ghost authors is something that is again done where someone else ends up writing the paper for you. What's your take? I'll have Dr. Arif, we'll start from you on ghost authorship. We know we spoke about gifting authorship. Now we're talking about ghost authors. So what's your take on this? Is that something, because now there are a lot of services available that you pay them up and you just send them your manuscript and they'll write everything for you, and then you can submit it to a journal of your liking.
I mean, this is something which needs to be condemned. It is something which is unethical. It is something which we need to stamp down as a medical society, that this is something which is totally unacceptable. If you are going to pay someone to write for you, then you might as well leave the profession.
Okay. Dr. Shatman?
Yeah, I think it's an interesting point. When I started industry, which funds a great deal of the research, excuse me, would bring in ghostwriters. And now what we see is industry having their own scientists who are excellent authors. And, we publish a lot of industry-sponsored research. And, some of the peer reviewers say, oh, it's from industry, it's probably not valid. And I say, no, some of the best science we get is from industry. And we're seeing collaborations between industry scientists and academic scientists. And those papers are oftentimes exceptional. And, I think the academic scientists will temper the amount of enthusiasm and the conclusions that are drawn to keep them appropriate given the data. So I think I agree with Dr. Arif. I think it's an abomination to have ghostwriters, but I think that the next step in the evolution has been to have collaborations and have both the industry scientists and the academic scientists working in tandem.
Professor Shedman, I think what Shariar over here was trying to point out is that in developing world over here, there's now a practice as well where people actually pay another person to write a paper for them. The point you were making was a different one there, because I mean now 9 out of 10 papers which are published in the New England Journal are pharmaceutical spores, and they are freely available as well. That is, I mean, science as such, that there is a process to it. Over here, what he was talking about was a situation where you have got a clinician who is looking to enhance his career, needs a couple of publications. So he goes to someone, shops around, who will write a paper for him. Is that the point you were trying to make, Sharia?
I was agreeing with you. I was agreeing with you completely that scenario
is
does
different one.
less so progressively.
No, I'm glad you both pointed. I'm really happy that you pointed out both things here because that was my second question now. I know, Dr. Shatman, I don't want to hold you any further because I don't want you getting late because you are participating in another conference right now. So thank you so much for participating. And Dr. Shatman's going to leave us, but we'll have Dr. Arif and Dr. Asif Loya for another 15 minutes.
Thank you very much,
And
Professor.
Thank you.
Thank you very
Thank
much.
you very
It's
much,
lovely
Professor.
meeting you,
Okay.
Chair. Always
Same here.
good to see you. Thank you so much for involving me. I love this lively discussion.
Thank
you
you.
very
Thank
much.
Thank you
you.
for
Thank you.
joining
Have-
us.
Have a
Thank
great
you.
day.
You too.
So we have few questions from our audience, and I'll start off. So one of the participants had asked that if I write my manuscript in Urdu language, will it be accepted globally?
Right.
Um,
I mean, go ahead,
go ahead.
Asif. It's okay.
Yeah, I mean, you can certainly write your manuscript in Urdu language. Globally, it all depends on the kind of journal that you're submitting to. In Urdu language journals, there are, I think, some that I'm aware of, but not many, and they're mainly based, obviously, in our country. So other than that, I think its acceptance worldwide would be difficult unless it's translated into English language. So yeah, that's going to be a bit of a problem. But obviously, you can always write your article if you have difficulty writing it in English and Urdu and have it translated, and then perhaps submit it to the journal. Once it's been reviewed properly by a language specialist, that it has been properly translated, and that there are no missing bits and points. So yeah, that's one way of looking at it, perhaps.
Dr. Arif?
As far as I'm aware, there's no journal either in India or Pakistan which publishes in Urdu and is a recognized medical journal as such. But there's no harm in writing in Urdu and having it translated. Once you get it translated, then the whole, what you call, all the journals will be available to you to submit.
Thank you.
But
Yeah, if you want to add anything.
no, that's it. Basically, you need to get it translated into English and then submit it according to the journal which suits it.
Yeah. Unfortunately, at this point, there are no Urdu-based medical journals that are available or recognized worldwide. So the other question is, which I guess came up from the discussion that we were having earlier regarding collaboration. So one of the participants has asked, how can they collaborate with someone based in US or any other Western country to participate with them in doing research? Dr. Arif, you want to take that first?
Yeah. What you need to do is to email that person who you feel would be helpful. Tell briefly what kind of work you are doing and why you want collaboration. Maybe it is some paper which has published or you have heard from someone. So what you need to do is to write to him and then see what kind of a response you get. If you get a positive response, that means you're in. Then he may be able to help you further with that. But obviously, for the email or the letter which you write, state clearly what kind of work you're doing over here, and what is it that makes you interested in him collaborating with you.
I think
Dr.
I
Asif?
think I think other than that, I think your mentor, if there is one, can certainly help you connect with the right person there in US or UK or in the Western world. Especially, I mean, if you're and other thing that really comes up is that when you're collaborating in that Western part of the world, you do open your studies. If it's some trial or something, then you do open it up for acceptance for a grant. Because if you have local collaborators from that part of the world, that really is a good thing that the companies or the associations that are giving out grants, they look for that you have a local collaborator in that part of the world. So yeah, I mean, as Arif pointed out, and then the other way is to have your mentor guide you and talk to some people that he already knows in that part of the world.
So one of the questions has already been answered by Dr. Shatman, I guess, before leaving. But I would like to ask you this question as well. So one of the attendees has asked, in Pakistan, researchers often face resource limitations when pursuing innovative research. How can these researchers effectively collaborate with their fields given their constraints and existing global research landscape?
See, the question is such a lengthy and a difficult one that first of all, I'm trying to
So they would like
comprehend.
so they would like to know, I guess, in other words, that if for someone who's sitting in a developing country, let's say Pakistan, how can they collaborate with someone who's sitting in Western countries? Because our resources at the end of the day are quite limited. I guess they want to know what's the other thing that they can do in order to even conduct the research itself, if it
Right.
comes to it.
I think like anything, it is also a process.
Mhm.
You start off your career as a medical student, then you become a houseman, then you become a registrar, and then you become a consultant. And during that period, you need to keep on progressing through the proper steps all the time. And once you have gone through that process, you will be in a position to be able to do your own research, because your own research you will be able to do only when you have reached a certain level. You won't be able to do a research if you have been appointed as a houseman. So it all
Mhm.
depends at which point in your career. In the junior part of your career, you will probably need a mentor or the person who you're working with who is going to help you out. And then if you have been successful, you will be in a position to do your own research at a later time. So resources are always constrained. I mean, yeah, even in US, if you go, you're not going to get free money to do research as such. So
Mhm.
you have to make your name, and what you call start off by writing case reports, retrospective studies. And once you have done that, then you move on to writing a trial, and then you may be able to do even more novel ideas as such. So it is a process where you have to go through different steps before you eventually reach the top.
Excellent ideas, Dr. Asif.
I think what Arif has said, is really something that will take you to where you want to be. You start by writing case reports, take it to case series, write some papers, and then eventually you go to trials, and then some, the good ideas that you want to come up with and that you come up with, you can work on that. As far as having a support, it all depends on the kind of institution that you're working in. I know that at Shaukat Khanum we have, if there are small studies, and if you are asking for institutional support for research, then there is a way to get that, and institution does support that. Obviously, it's always encouraged that you apply for a small grant, because then there are agencies in Pakistan, which actually do offer grant support for small studies or for case series and all that. And some of those, agencies like I'm forgetting. I'm not coming up with the exact names, but perhaps Shariar, if you have some idea, you can share that. But there are agencies that do support research here in our country, and people have you, especially if you're an academic institution or a university setup. That's very easy to get that if you're part of those.
Yes.
See,
So
in
go
all
ahead.
honesty, one needs to actually make a profile for himself. You need to show that you are someone who is capable of doing it. If you haven't published anything, you haven't done anything, and you come up with what you think is a novel idea, it is very unlikely that you're going to get any funding for it. But if over a period of time that you have been able to publish, you have been able to write, you have been able to work with other people, and then you have an idea and you write a good proposal as such, and then there's every chance that you will get it. But what you call initial phases of your career, where you're just beginning and you want funding for it, it is very difficult. It's unlikely to happen.
Yeah, so I agree. I think we need to build up on that. It's a process at the end of the day. And there are multiple institutes available, both nationally, such as Higher Education Commission, that
Yeah,
actually do
yeah,
have these grants that
obviously.
come up. And then I would recommend that there are a lot of international organizations, Bill Gates, Melinda Gates Foundation, Bill Gates
Welcome
Foundation.
Trust.
There are a lot of trust, a lot of international accrediting bodies, or even institutes, bodies or membership boards, for example, International Association for Study of Pain and so
Mhm.
forth, have these grants that keep coming up, and they actually have separate grants for developing countries. Regarding to ideas on how to find your mentors, I just want to add one quick thing on that, is that if you are unable to find any particular specialist you feel in your particular field. Again, go back to the references that you have cited in your own paper. Look at who are the authors for those particular papers. For example, you may find, for example, if I look at clinical or radiation oncology papers, I'll find there are a lot of papers on Dr. Arif Jamshed. So I might actually write to him, seeing that he's a common name among the different papers that I have cited. And maybe I'll ask him or request him that I have an idea that I would like to work on, and what's your take on it? And would you be interested in coming up and helping me on it? So I'll take one more quick question, which is on, is there a criteria for international publication? Because the student journals we often publish in get rejected from international journals. I think we have already discussed on this, that there are, what are the different processes for doing this? So I'll take another question. Are there any set of recommendations accepted globally that measure the research output? What are your thoughts on the San Francisco Declaration on Research Assessment, DORA? I'm not familiar with it. Dr. Arif, Dr. Asif?
I'll Google it after the session.
So one of the, so unfortunately, we are not familiar with this particular research output, but as Dr. Shatman earlier pointed out, and a lot of us do this, is that we look among the research output, there are different criteria for different institutes. Some institutes require that you need to have at least 5 articles published in a peer-reviewed journal. Other institutes have this criteria that you need to have articles published in journals that are PubMed indexed. Dr. Shatman pointed out that there is a criteria that some universities use where they multiply the impact, the publication with the impact factor. So in case if a manuscript was published in a journal that had an impact factor of 15, automatically that individual will get 15 points, whereas someone whose journal had an impact factor of 2 will only get 2 points on that. And then, all of these other different index journals or different platforms, Google Scholar has their own H index now that you can look at. Similarly, Research Assistant or Research Scientist is another website that you can go on to, and they have their own index that they can assign a score to the individual. This is it. We think we're going to end the session now. I'm really grateful to Dr. Arif and Dr. Asif Loya. Both of them kindly agreed to come and participate in this session. I enjoyed this session as always, because it's always a wonderful experience to, sit with them and, listen to what they feel. I know that was a hybrid session, so it's always very difficult. Ideally, I would like it to be in a conference room where I have a cup of coffee or a tea, and we can just have a very nice chat on this. But I'm really grateful to all the participants that participated in this hybrid session. I know there are some people who are sitting in conference rooms. Thank you, everyone. Thank you so much for coming in, and thank you to our panelists for participating and sharing their piece of wisdom with us. Thank you.
Thank you,
Thanks so
Sharia.
much, Sharia.
Thank you, everyone.
It's a pleasure.
Thank you.
Allah Hafiz.
Allah Hafiz.